There are a few different things we can do to improve the way in which we can communicate about the virus. First is to make it familiar. Second is to make it personal. And third is to say something actionable. So what do we mean by make it familiar? Well, oftentimes when there's something that people don't understand, it's because it's outside their realm of what they've seen before, right? And I think there's the reason that people keep comparing COVID-19 to the flu is because the flu is something that is familiar to folks. Now, we know that COVID-19 is not the flu. It actually seems far worse than the flu at this point in time. But the idea being that people need to associate with something that they understand. So saying something like COVID-19 is a virus that has symptoms that are similar to the flu, but is more severe and can cause worse outcomes could be one way to sort of introduce the virus to somebody who doesn't understand the public health symptomatology behind it. Second is to make the virus feel personal. So rather than saying that 20% of people have had these types of symptoms associated with COVID-19, we would say, did you know that your neighbor Nancy had X, Y, and Z happen? Now, the person you're talking to may not have a neighbor who had that happen, but the idea being to connect the message or what you're trying to say to something that is familiar within the person's social network, especially when that network, the more personal, the better, so to speak. So if it's a family member, someone they live with, a close friend, that's better than, say, your mother's sister's cousin's friend having something happen to them. So again, key takeaway is to make the message seem personable so someone could understand it a little bit better. And finally, to make that message seem actionable. So COVID-19 is scary. It's scary to see kind of what's happening to our healthcare system and what's happening to those who get sick. And it's important that when we're trying to share a message about something like social distancing, we can say that, yes, this is a scary virus. Yes, it's difficult to think about, but if you stay home, if you wash your hands, if you do X, Y, and Z, you have some ownership and efficacy associated with what you can do to prevent the spread and prevent yourself from getting sick. So again, the key takeaway is to make the message actionable.